My name's Kayla. I'm going to perform IV fluid and medication administration skills video. So first I want to verify the healthcare provider's order and make sure it's appropriate for our patient. I'm going to go ahead and enter the patient's room and provide privacy. I'm going to introduce myself. I'm going to ask the patient for their name and date of birth and check their wristband. I'm going to ask them if they have any allergies. I'm going to explain the procedure to them and make sure they have a good understanding and ask them if they have any questions. I'm going to perform hand hygiene and apply clean gloves. And so I want to check our first order, which is our fluid primary order. So we have our bag here. And I would want to check that the fluid is correct on the bag. I want to check the expiration date on here. I set that aside. I'll grab our tubing. This is the spike end that's going to go into the fluid and medication bag. This is the drip chamber here where you'll see the drops. We have our roller clamp and we want it in the off position. We have our tubing. We have our Y port here. This port goes into our secondary piggyback line. And this is going to go into the IV on our patient. So we want to go ahead and grab our fluid and we'll turn it over. We'll take this off, this cap here. We'll take the spike cap off too. And we'll insert the spike into here. And you gotta really twist it and turn to get it all the way in there. Okay, once it's in there, we turn our bag over and we wanna hang the fluid 30 inches above our IV and patient. Okay, there we go. Next, we want to make sure this is about halfway filled. So there we have it. And we want to make sure we get any air bubbles out of our RV, our line. That's very important. So we'll go ahead and turn this on and make sure all of the bubbles are out. Okay, then we'll close it back up. And then we'll check our order again and we'll review our calculations. So our primary order here for the fluid is 150 milliliters per hour with a drop factor of 15 drops per milliliter. So I did dimensional analysis and I got 37.5 rounded off to 38 drops per minute. So let's set that down for a second. So we'll have our watch, we'll check the time and we'll do 38 drops per minute. So we'll go ahead and get started. Now, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, and 38 drops per minute. So we'll turn that off. Okay, and we want to grab our secondary bag of medication. So here it is here. Again, we'll check the bag and make sure the medication is correct, the expiration date. We'll grab our tubing here. We'll have to turn our bag over. We will take the cap off and take the cap off the spike. And we'll spike it. So again, we have to kind of twist and turn. Okay. There we have it there. And then we'll grab our port over here out of our primary line, okay? This port that I mentioned earlier that's gonna go connected to the secondary bag. We'll grab an alcohol swab and we're gonna clean it, and we'll clean it here for about 15 seconds. Okay, and then we'll go ahead and connect it. To our secondary. So we'll take the cap off of that one. Okay. And we'll connect it there. Okay, it's nice and secure. And we want to keep that sterile the whole time, so we're not going to touch it after we've cleaned it. We'll go ahead and turn this over. And then we want to take our primary bag and have it below our medication. So we'll put our primary bag down here, and we'll put it here, okay? And we do want to make sure that we attach the sticker, okay? The sticker is going to prevent any errors. It has the patient's name, the drug, flow rate, start time and date, and expiration. So we'll go ahead and attach that to the bag. We want to check our 5 rights of medication administration, which is right patient, right route, right time, right drug, right dose, and right documentation. Now that we have, we want to do the same thing and make sure that the drip chamber here is filled halfway. We want to also take any air bubbles out. Same thing. So we'll just turn it to the on position. Make sure we get all the bubbles out. Okay, that's very important. So then we turn it off. There's no bubbles. Okay, then we'll check our order again and verify our calculations. So we have our secondary order here of amoxicillin, 250 milligrams IV and 100 milliliters of normal saline over 15 minutes with a drop factor of 15 drops per milliliter. And we end up with 100 drops per minute. Okay, so then once that's ready to go, we have our watch, and we'll do the same thing here. We're going to go ahead and count 100 drops per minute. So we'll turn this on and we would get started. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So once we get to 100 drops per minute, we would turn that off. And we want to make sure that our patient tolerated the fluid and medication. We want to document the procedure and document how they tolerated it. We want to take our gloves off, and we would perform hand hygiene, and that's it.